it was a good meeting. Most of the data, as I said, that were updated result of previously major trial. For example, we have updated analysis of KEYNOTE-177 that was comparing checkpoint inhibitor pembrolizumab to conventional chemotherapy in patient with mismatched repair deficient colorectal cancer, which a small number of patients, but this trial showed that almost doubling in PFS of 16 versus 8 months. And I think interesting thing was in this updated analysis, they look into the second progression-free survival, which was defined from the time of randomization to progression on second-line chemotherapy. And it was about 23 months, if I recall, in the patient with chemotherapy, and it has not reached in immunotherapy. And even though patients were crossover, so there is a chance that we may not see the survival difference, but that showed that it was associated with high response rate compared with chemotherapy. The progression-free interval was 48% at 2 years versus 18%, and the quality of life was better. So that's, I think, a very promising practice-changing study, and I'm hoping that in Canada we have this option available soon for our patient. We also have the updated overall survival data of IMbrave150 study in the hepatocellular cancer. Previously, we only had sorafenib as a standard. So this study compared a combination of Atezolizumab, which is a checkpoint inhibitor, and bevacizumab based on the biology. And again, showed a very promising survival of 19 months with the combination versus 14 months with sorafenib. So I think that's another important study. The important thing that we noted in this study that response rate was high, 30%, but more importantly, we have 7% complete clinical response rate. So that's suggesting that this patient potentially may have more durable response and like melanoma that we are seeing some long-term remission. We also have updated data with ClarIDHy study that was looking at IDH1, the isocitrate dehydrogenase mutation inhibitor. That's, if I recall, Ivosidenib. And that was compared with placebo. It was presented last ASCO that show hazard ratio of less than 0.5 to improve the progression-free survival, and they presented the updated analysis, the survival data also. And again, this study was compared with placebo, so patients were crossover. So we are sure not going to see a significant difference, but this is, I think, a step for the personalized treatment, looking for this mutation, which we see in about 30% patients with intrahepatic cholangiocarcinoma. And that's promising.